Okay, we are back talking with Dr. Wafik El-Deiry about cancer and cancer treatments and new drugs that are being developed. Dr. El-Deiry, can we start out with talking about advances in the medical community in developing new drugs to treat cancer?
Sure, thank you. We have been making advances in recent years with some real breakthroughs that have been helping people live longer in different tumor types, including the Nobel Prize in Medicine 2 years ago for immunotherapy, which involves getting the immune system to fight cancer. And that's been a very exciting breakthrough.
And how exactly does that work? Can you explain to our audience what immunotherapy is and why it is such an exciting breakthrough?
Sure. As tumors grow, they basically block the immune system. If we had a great working immune system, we'd never develop cancer. So the progress has been in figuring out what is it that the tumors are doing so we can block that to unleash the immune system to fight the cancer.
Okay, you've also studied the effects of chemotherapy and radiation on various types of cancers and tumors. How does studying the treatment of cancers help advance cures?
Well, we've been interested for many years in just how do cancer cells die? What is it that chemotherapy and radiation do to get rid of cancers? And we've learned that that involves some genes that we all have called tumor suppressor genes. And these tumor suppressor genes work to keep cancer under control or to make it go away when our patients receive chemotherapy or radiation. And so learning about how that process works has been a great way for us to gain insights into developing new drugs to achieve the same purpose when the tumors are resistant to treatment.
And not all cancers are the same, right? People call cancer cancer as if it's one thing, but in fact there are many hundreds of different types of cancers. In fact, even in breast cancer alone, there are many different types. So are there specific cancers and tumors that react better to some of the new advancements you're seeing?
So at some level, it could be said that no two tumors are alike. On the other hand, there are a lot of common themes that work their way across cancers in terms of drivers, genetic changes that make these tumors grow and divide and avoid the immune system and ultimately grow and metastasize. It's also exciting, in the era of precision medicine where we have the tools. We have a lot of new technologies to interrogate tumors. What makes this tumor tick in this particular patient? And so now we can tailor treatments to specific patients given that incredible heterogeneity of cancer.
Great. Okay, you are working on something called TRAIL. What is TRAIL and how does it work?
Well, it's a complicated acronym, and it stands for TNF-related apoptosis-inducing ligand, and TNF is tumor necrosis factor. So it's alphabet soup, and it's basically part of what's referred to as our innate immune system that suppresses cancer and its metastases. And we've asked the question for many years, why doesn't this work the way we would like it to work? And so we have studied how does this pathway work normally in our bodies, and then have pursued strategies to boost this immune response so that we can achieve therapeutic gain when we treat our patients.
You've also done some work around how we identify what kind of cancers. You talked about precision medicine earlier. There's also been research being done about the difference between liquid and tissue biopsies in terms of determining which is better for identifying treatment. Can you talk to us a little bit about that development and how you think that's going to affect cancer treatment in the future?
Sure. So liquid biopsy has emerged in recent years as a way to learn something about a patient's tumor and to get a snapshot in time as their disease grows or as they are treated. And it's a really powerful technology that really complements what we have done for decades with tumor tissue And the applications of liquid biopsy are really growing. It's a simple blood test that a patient can have in the clinic, but we can get information on how much tumor DNA is in the blood, what mutations are there that we could use treatments to target, what are the resistance mechanisms to the treatments that are coming up as patients are treated and maybe their tumors are not responding so well. And I'd say it's a work in progress, but it's an exciting technology. It's here. People should know about it, and it's going to continue to grow and be used more over the coming years.
Terrific. Professor Dr. Wafik El-Deiry, thank you so much for coming on and talking to us about the future of cancer treatment.
Thank you.